A tia I mauri ora. He onore e karori e ki te atu e runga rawa. E maunga rongo runga te matu te wenua. Wa karo pai ki ngā tāngata katoa. No rea karori te atua. Nāna te homai tēnei te rangi pai. I roto tōringo na tapu aia nei āke tona atu. Āmene. A tēnei te tūake nei ki roto I tēnei te whare e tū nei. Te taha nei o te wanganui ātara, me ngā maunga waka I, ko mātairangi, tangi te keo, ko au mairangi, I tū maira, ko rumutaka, I reira nei, ne mihi atu ki a rātu. Me mihi atu ki ngā awa e urere atu nei, mai te maunga tai atu rā ki tēnei te moana. Te moana raukawakawa, e mihi atu ki a rātu. No reira, huri noa, te ruma nei, me mihi atu ki au koutou, tēnā koutou, tēnā koutou, tēnā koutou katoa. E tai koutou mai ngā roi katoa o Aotearoa, mai te nota, te wet, ana te rāwhiti, me te tauhauru, no reira, e mihi atu. Nau mai. Nau mai I rongi I tēnei te kaupapa te rā nei. Kei roto I a koutou nā hapaenga te oranga o nā tangata. Nō rei tēnā koutou. E tū nei te mihi atu hoki ki tēnei te wāhi ngaro. Kia rātou kua haere ki te pō. Ki e te I kei wangi a tātou tēnei rā, nō rei haere atu rā. Hoki atu rā ki te kāinga tūturu o tangata. Me noho I reira, noho no atu. Nā reira kā tira, rātou ki a rātou, tātou ki a tātou. A tūnei, ki a koe e te minita. Te minita Clark, mihi atu ki a koe. Ka tae I rungi I tēnei te kaupapa nei, mō tēnei ngā kaiwaka haere, e wakarongo ki a koe te mena kōrero mai, e roto I te hauora. Me mihi atu ki a koutou. Me koutou hoki ngā kaiwaka aere o tēnei hui, ka nui te mihi. Tēnei he hono I tēnei mō mātou o Tiawa, o Taranaki Wānui, o te wanganui a tara ki a tau mai nei te mihi ki a koutou katoa. Nō reira, tēnā koutou katoa. Well, I've talked about our mountains. Mātairangi, Ahumairangi, and Rumutaka, which is here in this Wanganui Atara. The great harbour of Tara out there, the Wanganui Atara. Our people, we come from here, from Taranaki Wānui, Te Atiawa, Ngāti Tama, Ngāti Ruanui, ana ko Aotea hoki. No reira, we mihi atu ki a koutou. So I'm just here to sort of, this is the Whakatau ki a tātou katoa. No reira ki a pai tō haere, ki a pai o mai o te rānei, kōrero nā kōrero, purutia nā wakaro, ki a tae mai ki te e, no reira haume e, a hui e, tae ki e. Te aloha. Tēnā koutou, a kia ora hui no tātā. Kia ora.
Tēnā koe matua mā, mō tō awhi te ata. Thank you matua for your support this morning. Ngā mihi mahana kia koutou, warm greetings to you all. Kia ora, I am Mania Farah, and I have the privilege of being your MC for today. And so I work for Te Pūtahitanga o Te Waipounamu. I'm the commissioning manager, and we are the South Island Whānau Ora Commissioning Agency. So it's my absolute privilege to be here with you today, and also to introduce our opening speaker. Today is Honourable David Clark, from the Minister for Health. Thank you, Minister Clark, for making yourself available for our event this morning, and I understand you will have to leave soon after, so we really appreciate your time. Minister Clark was first elected as a Labour Member of Parliament for Dunedin North in 2011. Minister came to Parliament after managing the University of Otago Residential College, working as a Presbyterian minister, and also as a Treasury analyst. One of the key reasons the minister stood for Parliament was because he was concerned about the growing gap between rich and poor, which he sees as limiting New Zealand's social and economic potential. Inequality featured strongly in his maiden speech to the House of Representatives in 2012, and the minister believes we can and must achieve a fairer society where everyone has the opportunity to succeed. Please put your hands together for the Honourable David Clark.
Te hei Māori ora. Tēnā koutou, tēnā koutou, tēnā tātou katoa. Ki tā atua me whakakororia tōna ingoa I ngā wā katoa. E te wharine, te papa, tēnā koe. Tēnā koutou I au tātou tine mate, haere, haere, haere atu rā. Apati hono, tātai hono. E te iwi, tēnā koutou. Ki ngā tangata whenua, e ngā mana, e ngā reo, e ngā waka. Nō reira, tēnā koutou, tēnā tātou katoa. My name is David Clark, and I'm your Minister of Health. Thank you very much for that very accurate introduction. Indeed, I was a Treasury analyst. Please do not hold that against me. I want to acknowledge at the start Donna Matahaere Atariki for her service as the outgoing chair of the Health and Disability NGO Council. I've worked with Donna in Dunedin and observed the great progress in the South Dunedin project recently. Donna, thank you for your service. It is a real pleasure to be here today to open your forum. The work that Health and Disability NGOs do is an important part of our health service. I'd like to acknowledge all of you for the work that you and your organisations do every single day. It's appreciated and valued not just by me, but of course by people across the health service and of course New Zealanders who access your services across the country. There are thousands of families, as you know, millions probably, who benefit. The theme for this forum is Change is Here. It's befitting, given the change of government last year, that certainly resonates with me as a theme. Our government has hit the ground running, whether it's housing, health or education. The Labour-led government is determined to make positive change for New Zealanders. Our Prime Minister is relentlessly positive and has an aspirational vision for New Zealanders' futures. It should encourage us all, I think, to lift our sights a little higher, not just to accept things are the way they have to be now. I want to say up front that I view these conversations like the one that you're having today, the one that I've been invited kindly to be a part of, to me is part of an ongoing conversation. You will hear a little from me today about our government's priorities, but I also want to hear from you. I was a little critical of my predecessor for not being a part of conversations, and I'm trying to model being a part of those conversations and making sure that I build relationships with the sector. In my observation, there have been health ministers of both stripes who have been engaged, and they have been able to make constructive change. Not always what everyone would want, but those who are engaged have proven most able to make change that's been lasting and constructive. And so, I mean, my plea is to continue that relationship, even if we don't agree. I promise to keep listening. To ignite this conversation, I want to share a little about the government's direction in health. It's important because I think it will help you understand our priorities and our willingness to work with you. It is clear to me that New Zealanders expect us, of course, to work constructively together to achieve the outcomes that they deserve and expect. My priority is to strengthen New Zealand's public health service. A public health service that delivers that care, one that we can be proud of together, where your social or economic background does not determine the quality of care you receive or the health challenges that you are likely to face. For this government, health is a fundamental social service and it's not a marketable product. I got into politics because I'm concerned about inequities, and that was a part of the introduction. I think that we will only address that if that is the priority, if we look to inequity, if we focus on building a public health service. The evidence is where we have strong public health provision in the world that the outcomes are better, increased focus on mental health and primary care, and I'll say a little bit about those things as I work through. A public health service is not about every person for themselves, it's about community looking out for each member. Strengthening our health service is a touchstone for me, and striving toward a first-class health service will always be front of mind for this government. Our government has a different approach to health, as I said from the outset. We know that health is everything, and New Zealanders expect their health service to be there for them and their loved ones when they need it most. Health and disability NGOs are a key part of New Zealand's health service. Many New Zealanders interact with the services that you provide every day. I've seen the work that you do firsthand, and I guess that's part of why I value it so much. At a personal level, of course, I've known many people, as have we all, who have interacted with and received help from NGOs in their communities. My mother is a GP, and she has worked with a number of NGOs through her lifetime, and her experiences too have shaped the way I think about NGOs and the delivery of health services. In my role as an MP, I've been privileged, of course, to visit a number of services and see things firsthand, not just in my electorate, but across New Zealand. One that I'd like to just talk a little about today is Arts Centre based in Dunedin, because to me they demonstrate the value of services that are embedded in community. For those of you who aren't familiar with Arts Centre, they're one of New Zealand's most enduring art spaces for people in the mental health community. I've long been inspired by the work that they do. I visited numerous times as the local MP, and in my most recent visit I observed people participating in a creative writing session where people were sharing their own personal stories, writing and sharing their own personal stories. While I was there, I got to speak to a number of artists who are finding ways of expressing themselves, and some of them thinking about a career in art, and that is the vehicle they've found to have a real sense of belonging, a sense of place, and a sense of purpose. It's an example for me of an NGO that helps people every day in our community. The service they provide is invaluable because it's about empowering people, restoring their self-confidence and independence. I'm advised that in an average week, 1 million hours are worked by paid NGO staff, and over 150,000 hours are provided by thousands of unpaid volunteers. Each of those hours represents New Zealanders receiving support they need. So again, thank you for the passion and commitment that you invest in New Zealanders. The example I gave of Arts Centre is one of an organisation working with people facing mental health issues. And I speak of that specifically because, as I said earlier, mental health is a priority for our government. We know that the demand on mental health services is felt across the country, both in community and secondary services. Demand or the number of people accessing services has gone up about 70% in the last decade, and funding hasn't kept pace with that. You'll be familiar with the mental health inquiry that we've launched, an independent inquiry, and I'll say a little more about that. You will know, as I do, that these mental health services are critical to the well-being of our communities, and the work that you do as NGOs is incredibly important work in that area. I want to borrow from the theme for today's forum, change is here. We announced the mental health inquiry independent inquiry into mental health and addiction in January this year, and it's a response really to the concern about mental health coming from the community, from within the mental health sector as well as more broadly. Service users, their family and whānau, people affected by suicide, people working in health, media, iwi and advocacy groups have all been calling for a wide-ranging inquiry. Ultimately, people need to get the help that they need. I think it's important to be really clear that there are so many critically important people who are committed and highly skilled already working in this area, and I make sure whenever I'm talking about the inquiry that I mention that and thank them, because this inquiry is very clearly not about beating up those people who are devoting their lives to supporting, in many cases, our most vulnerable citizens. Despite this, not everyone is getting the help that they need, and we know that there are some groups who struggle to get access to services. The inquiry will listen to people with lived experience of mental health and addiction problems, people affected by suicide, emergency service workers, people involved in preventing and responding to mental health and addiction problems, whānau, the list goes on. And I encourage you in this room to consider submitting to that inquiry. One of the things I've been clear about in setting up the inquiry with the terms of reference is that there have been a number of inquiries already. And you think back to the Mason one, right through to the People's Mental Health Inquiry before the election. One of the things I wanted to be clear on was that I don't want that work to be repeated or to have people in the sector who are somewhat tired of submitting to inquiries, submitting to another one and having to say the same things all over again. So I've asked that inquiry panel to take those previous inquiries as read, to look at the recommendations in them that have not been implemented as a starting point and update from there. And that comes from feedback from the NGO sector. So I've been very clear about that up front. I've also pushed back quite deliberately. The Ministry of Health initially tried to get me to narrow the scope to focus on services. I want to look at community, I want to look at social determinants and prevention, that broader picture, because I think it is an untidy area, and although if we looked at one specific element of service delivery we might get a neat answer, the fact is a neat answer without looking at the big picture is not the right answer in my view. So I've asked for that to be a broad inquiry deliberately. There will in the inquiry be a particular focus on equity of access, community confidence in the mental health system and better outcomes, especially for Māori and other groups with currently disproportionately poorer outcomes. And the report's findings will be reported back to me by the end of October this year. It's a short and sharp inquiry. Many pushed for a Royal Commission, but my feeling was that with so much work already having been done, what we need is an update and a plan for action so that we can get on with things sooner rather than later. And I'd like to acknowledge the members of the inquiry, which is being led by Professor Ron Patterson, and specifically note that one of the inquiry members is Dr. Barbara Disley, an elected representative of the NGO Council. I'm sure known to you all. Her in-depth understanding of mental health and addiction services will make an invaluable contribution to the inquiry team. In my address, I have touched on some of the key issues from my perspective, but I'm attuned to the fact that there'll be a number of topics of interest and concern to people in this room that I may not have covered today. And I understand particularly that the NGO Council has strong views about service commissioning and the workforce, the health workforce. These are two issues which are of particular interest to me also, so I'm looking forward to meeting with the Council at some stage soon to discuss these issues. It's also been clear that I've been clear that NGOs are an important part of the health service because it's important for me to hear your views and identify ways that we can work together constructively for the future. So in conclusion, I just want to say it's a real pleasure to be here. Thank you for having me. This government is committed to strengthening our public health service and delivering the care that New Zealanders expect and deserve. The public expects us all to work well together, and it's in the public interest that we do work well together. I think it's one of the wonderful things about the health sector is that people are all committed to the best outcome for the people who access our services, and so we have a common rallying point. I'm aware that so much of the health sector has been stretched over the past years of underfunding. While we can't turn that all around in one budget, the mental health equity signal we've given, I think, will be welcomed, and we are making progress in that regard. So more to come. Also, one of my jobs as an Associate Minister of Finance is to moderate expectations and be very clear that it will take more than one budget to address 10 years effectively of underfunding in the sector. That will be no surprise to you. The public expects us to work together, as I've said, and I'm looking forward to working with you. We've got a lot of work together today, and I expect this to be the start of an ongoing conversation as a minister. Of course, I've met with many of you before becoming a minister, but in this capacity, I look forward to the ongoing conversation. It will be an exciting day today. Having looked at the schedule, I've seen that you've got some high calibre speakers and some interesting time ahead. I think it will ignite some lively and interesting discussion. And I would encourage you in closing to be ambitious in your thinking, lift your sights high, and don't be afraid to challenge the status quo. One of the things I've signalled to that mental health inquiry, which is independent, is that independence is there for a reason. They can make challenging recommendations to government, and that's deliberate. As a first-termer in a first-term government, I don't have any particular axe to grind. I'm ready for some challenging recommendations. I might not always agree with all of them, but let's have a robust debate because we need to for the health of the people that we care about in this country. It's my pleasure then to open the Health and Disability NGO Forum 2018. Thank you for having me and enjoy the day. Thanks very much.
Tēnā koe, Minister. Thank you for your opening address and for acknowledging the value and importance of the NGO sector. Also your commitment to strengthening the public health services and your encouragement to challenge the status quo for everyone here. Ngā mihi.